Good afternoon, bon après-midi à tous. My name is Julie Turcotte and I will be your moderator today. Je m'appelle Julie Turcotte et je serai votre modératrice aujourd'hui. Thank you for joining us for today's media availability regarding the release of a new mapping tool that outlines vaccine uptake by neighborhood. Merci de vous joindre à nous aujourd'hui pour ce point de presse concernant la publication d'un nouvel outil de cartographie qui décrit l'utilisation des vaccins par quartier. Before we begin, just a few reminders. Please place your microphone on mute until invited to speak or to ask your question. To view who is speaking on Zoom, please put your view on speaker view instead of gallery view. The button for this is located on the top avant de commencer. Merci de bien ouvrir votre microphone jusqu'à ce que je vous invite à poser votre question et veuillez changer votre écran au mode speaker en anglais pour pouvoir mieux voir les porte-paroles. Le bouton est situé en haut à la droite de votre écran. Reporters with accessibility needs can pin our interpreters Paul and Laura or follow along on the YouTube stream. Les journalistes ayant des besoins en matière d'accessibilité peuvent épingler les interprètes Paul et Laura ou suivre la diffusion en direct sur YouTube. Today we will be hearing remarks from les porte-paroles avec nous aujourd'hui sont Dr. Vera Etches, Chief Medical Officer of Health with Ottawa Public Health, la médecin en chef Santé publique Ottawa, Councillor Keith Egli, Chair of Ottawa's Board of Health, le président du Conseil de santé d'Ottawa, Corinne Mackey, Supervisor of Community Engagement at Ottawa Public Health, le superviseur de l'équipe d'engagement communautaire avec Santé publique Ottawa, Kelly Tonner, Executive Director of the Southeast Ottawa Community Health Center, la directrice générale du Centre de santé communautaire du Sud-Est d'Ottawa, Andrea Gardner, the Associate Executive Director of Jewish Family Services, and the co-chair of the Ottawa Local Immigration Party des services à la famille juive et pour l'immigration d'Ottawa, Immigration Partnership, OLIP, la directrice du partenariat local pour l'immigration d'Ottawa. Also on the line for questions, we will have Amira Ali, Program Manager, Epidemiology with Ottawa Public Health, la gestionnaire de programme en épidémiologie de Santé publique Ottawa, and Katie Carr, the Program Manager for the Ottawa Neighborhood Study at the University of Ottawa, la gestionnaire de programme pour l'étude des cartes. We will take questions from the media. I now turn it over to our Medical Officer of Health.
Thank you. Good afternoon, bonjour, and Quay. And I do wonder if the bandwidth is just a bit challenged by all of our videos. If we might have to go to switching them off, except when we're speaking. And I'm sorry, just to see if that helps. And so I am happy to be joined today by more people than usual, our Board of Health Chair Egli, Ottawa Public Health colleagues and partners at the Ottawa Local Immigration Partnership, the Southeast Ottawa Community Health Center, and the Ottawa Neighborhood Study. So today we're releasing information that outlines COVID-19 vaccination coverage by neighborhood in Ottawa. There's an interactive mapping tool that provides a snapshot in time of the cumulative percent of individuals aged 12 and over who received at least one dose of COVID-19 vaccine and those who are fully vaccinated. That's the 2 doses, based on the geography that's established by the Ottawa Neighborhood Study. This is the same neighborhood approach we use to provide information about people testing positive for COVID-19, testing and percent positivity rates by neighborhoods in Ottawa. So the vaccination data by neighborhood will be updated every 4 weeks. Ottawa Public Health, the city, and healthcare and community partners use this data to address barriers and inequities in COVID-19 vaccination through responses that focus on specific neighborhoods and populations. Santé publique Ottawa, La Ville, les soins de santé et les partenaires communautaires utilisent ces données pour éliminer les obstacles et les inéquités dans la vaccination contre le COVID-19 grâce à des interventions axées sur des quartiers et des populations spécifiques. So some of this work is accomplished through mobile clinics and neighborhood vaccine hubs. My colleague Kareem will speak about this soon. And so this data, which is now available on the Ottawa Neighborhood Study, ONS website, has shown us that vaccination coverage is lower in less advantaged neighborhoods than in more advantaged neighborhoods. And this has a correlation with some of the larger Black and racialized population percentages. We've seen in past reports this disparity between less and more advantaged neighborhoods is persisting throughout the pandemic, despite significant efforts by many partners to reorient services to meet the greatest needs. So I want to be very clear about the neighborhoods where there is lower vaccine uptake. It is not necessarily that people are vaccine hesitant. Rather, there are also systemic barriers that prevent access to vaccine information and opportunities for vaccination. Ce n'est pas nécessairement que les jeunes hésitent de se faire vacciner, mais il existe des obstacles systémiques qui empêchent l'accès à l'information sur les vaccins ainsi que les possibilités de se faire vacciner. So, for example, residents of these neighborhoods are more likely to work in jobs where taking paid sick leave to be vaccinated is difficult or impossible. Other barriers include language, transportation, lack of computer and internet access, a need for childcare, or a lack of trust in government agencies and in the healthcare system given previous negative experiences and systemic racism. Some may not have a primary healthcare provider with whom they could discuss vaccine questions, and the factors influencing immunization uptake go beyond just the operation of the healthcare system. So Ottawa Public Health, the City of Ottawa, we're continuing to work closely with our healthcare and community partners like the Ottawa Local Immigration Partnership and community health centers across the city to address barriers to vaccination. We are seeing the coverage rates in disadvantaged communities grow as more options are added. All health system partners have a role in promoting vaccination to their patients and clients proactively and as opportunities arise. And employers in Ottawa can play a significant role by providing time off for employees to get questions answered, to get vaccinated, and if they're feeling unwell after getting vaccinated. Additionally, employers can request a mobile clinic to come to their workplace. So visit our website for details. Tous les fournisseurs du système de santé ont un rôle à jouer dans la promotion de la vaccination auprès de leurs patients et de leurs clients de façon proactive et au fur et à mesure des occasions. Les employeurs d'Ottawa peuvent jouer un rôle important en accordant des congés aux employés pour qu'ils puissent obtenir réponse à leurs questions, se faire vacciner et prendre du mieux s'ils ressentent des symptômes après leur vaccination. De plus, les employeurs peuvent demander une clinique mobile pour leur lieu de travail. Visitez notre site web pour plus de détails. So while all communities now have the majority of their eligible populations immunized, we want every single community within Ottawa to be protected against COVID-19 as much as possible. And we're heading towards 90% coverage across our city. We know that a high level of vaccination protection is part of our path to getting safely back to the people and activities that we love, and to protect against more transmissible variants like Delta. Vaccines save lives. Vaccines are saving lives. Les vaccins sauvent des vies. And lastly, in addition to ensuring we're fully vaccinated as soon as possible, there are other actions we can all take to reduce the risk of COVID transmission, including wearing a mask in closed spaces and crowds, maintaining physical distance from others, and staying home when sick, except to get tested. So visit our website for more information, and if you still have questions, you can reach out to one of our public health nurses over the phone at 613-580-6744. 613-580-6744. Thank you, merci, miigwech.
Thank you, Dr. Etches. I'd like to invite Councillor Keith Eglai, Chair of Ottawa's Board of Health, to speak.
Thank you very much. Hello, bonjour, Quay. Thank you, Dr. Etches. And I too am happy to be here today with our partners at the Ottawa Local Immigration Partnership, the Southeast Ottawa Community Health Centre, and the Ottawa Neighbourhood Study. I'd like to thank our partners for the continued support and incredibly important community work. None of this would be possible without your efforts and your expertise. The conversation we're having today is important to understand what the barriers to vaccinations are and what we can do as a community to better support each other. As has been said before, we have all been in the same storm, but we are in different boats. To work towards community immunity, we first have to understand what the barriers to vaccination are. If you haven't got vaccinated yet, there have never been more opportunities for you to do so. Drop-in vaccinations are available for first or second doses at any neighborhood vaccine hub or community clinic in Ottawa during their hours of operation. Various other locations offer the vaccine in Ottawa, such as select pharmacies, clinics for Inuit populations, and mobile vaccine clinics for workplaces. Vaccination for homebound people is also offered. If you are vaccinated, thank you for doing your part. You can continue to support vaccine efforts by reaching out to your friends, family members, or colleagues who may be unsure about getting the COVID-19 vaccine and telling them about your experience. Ottawa Public Health has a guide on their website with some great tips to help your loved ones and the people you live or work with to feel more confident in getting the COVID-19 vaccine. Thank you, merci, to everyone who has worked and continues to work on our vaccine efforts and towards community immunity.
Thank you, Chair Eglai. I'd now like to invite Kareem Mekki, Supervisor of Community Operations at Ottawa Public Health, to say a few words. Kareem, c'est à vous.
Bonjour, Quay. My name is Kareem Mekki, and I'm Supervisor with Ottawa Public Health's Community Engagement Team. Our dedicated team of staff have been on the ground working directly with residents and community partners throughout the vaccine rollout to provide information and to answer questions about the COVID-19 vaccine in a multitude of languages. The team has years of experience in community development, reflect the diversity of our communities, and speak a combined 12 languages. The focus of our work is to engage and listen to the community, promote vaccine confidence and access, and build relationships with people living in disproportionately impacted neighborhoods. Travaillant directement avec les résidents et les partenaires communautaires, l'objectif de notre travail est d'engager et d'écouter la communauté, de promouvoir la confiance et l'accès au vaccin, et d'établir des relations avec les personnes vivant dans les quartiers touchés de manière disproportionnée. Recognizing the importance of information sharing and addressing misinformation, we relied on community feedback to identify useful communication strategies. The team works with faith leaders to reach community members and has hosted large multilingual town halls with medical experts, social workers, and community developers to develop and to answer questions from residents about vaccines. We've hosted Vaccine 101 presentations to other service providers and frontline workers, such as settlement agencies and community developers, to provide them with the important vaccine-related information to help them to better support their own clients. In addition, OPH has hosted 43 events, including virtual town halls in nearly 20 languages, including Arabic, Somali, Lingala, Spanish, Kinyarwanda, and Cantonese, amongst others. OPH also developed multilingual WhatsApp tools in Somali and Arabic to share important vaccine and COVID information. We also launched an online series of multilingual ambassador stories, which are videos featuring community members sharing their experiences during the pandemic, including the moment they received their vaccine and the important role they play in contributing to community immunity. And in parallel with neighborhood outreach and information sharing, our engagement team co-chairs a committee of practice consisting of a weekly meeting which includes more than 40 members, including, for example, community health and resource centers who work directly with communities that have been disproportionately impacted by COVID-19. The community of practice is an important source of guidance and information as vaccine rollout continues to progress, informing locations of vaccine clinics and how to help people book appointments and communication strategies. Pop-up clinics, exclusive to residents to those neighborhoods, were set up in areas recommended by communities to make it as easy and convenient as possible. OPH canvassed neighborhoods distributing appointment cards in the days leading up to the clinic, while making sure to maintain some capacity for walk-in appointments. nearly 36,000 doses were administered through 140 pop-up clinics in 24 different locations. OPH also worked with faith leaders to host smaller clinics at places of worship that serve many members who live within high-priority neighborhoods. Vaccine clinics were also held in workplaces located within disproportionately impacted neighborhoods or whose employees live in high-priority neighborhoods. And in terms of next steps, OPH continues to build on its engagement work and has launched an approach to increase vaccine access in low-coverage neighborhoods. For example, mobile community clinics, where workplaces, community organizations, places of worship, and other groups can now request a mobile vaccine team to administer first and second doses of the COVID-19 vaccine on site at their own location. And this will help bring vaccine access closer to where people live, work, and worship. And since it's been launched about 3 weeks ago, we've received 61 requests, 15 of which have been completed, and 768 doses have been administered. We also have the Public Health Neighborhood Vaccination Hubs, which consists of creating regular yet consistent and hyper-local micro-vaccine clinics within neighborhoods with the lowest coverages. These clinics are coupled with door-to-door outreach by OPH's community engagement team, as well as with community partners. A pilot of this clinic has taken place in Ledbury Heron, and since we've opened several sites across other high-priority neighborhoods. As Dr. Etches mentioned, we want every single community within Ottawa to be protected against COVID-19. Using a community-centered and a community-informed approach, OPH continues to work directly within neighborhoods and in partnerships with communities to understand the needs and how to address barriers to get vaccinated. Thank you. Merci.
Thank you, Kareem. I'd like to invite Kelly Tonner, Executive Director of the Southeast Ottawa Community Health Centre, to share some remarks. Kelly?
Thank you and good afternoon. This data shared with you today reminds us all that there's still work to be done and that the effort to ensure we have a 90% vaccine coverage rate or higher across all of our neighborhoods needs us to be a collective effort. The Ottawa Health Team, Équipe Santé Ottawa, is a collaborative of 70 plus health, community, and social service partners that have been working together during the pandemic to strategically respond to those disproportionately affected by COVID. We have recognized from the beginning that the response to COVID and now the uptake in vaccines is not just a healthcare problem to solve. It needs to be a collective effort to address the systemic inequities that continue to impact certain communities. It's important to note that it is not simply a matter of proximity or access to vaccine for these neighborhoods. For some, it is that simple. We know that there are still people out there who want the vaccine, but due to barriers mentioned by Dr. Etches, they haven't been able to access it yet. As Kareem mentioned, our work is to get these options as close to their door as possible at a time that is convenient for them. So we are doing this through homebound vaccinations, these community hub clinics Kareem mentioned, community health center clinics, and the workplace and community organization clinics. This work is happening and it is ongoing. But we also know that there are people who haven't accessed the vaccine yet because they're worried, or they're worried about the vaccine themselves or the side effects. They perhaps have not had a great experience in the healthcare system to date, or are finding it difficult to navigate all the vaccine information, misinformation, and disinformation, particularly if English or French is not their first language. Consider the person who doesn't have a primary care provider where they can ask questions about the vaccine and their own health conditions. Or consider the person that doesn't have paid sick days from work, who's already worried about rent and bills, isn't sure how they would afford groceries in the event that they needed to take time off work to get the vaccine, or might not be able to work due to side effects. Or the single mother who is worried about how she will take care of her children if she experiences side effects, and who has heard a lot of conflicting information about the safety of the vaccine. In our outreach efforts, we have come across people who state they will never get vaccinated. In our high-rise vaccine clinics, we came across one such fellow. He championed himself as the resident anti-vaxxer in the building. But with continued outreach workers spending time in the building, spreading information, and having access to a nurse with whom he could speak with, and seeing the impact of COVID on a friend of his, he came to us and asked, "Can you give me the vaccine? And can I videotape you doing it? Because I'd like to spread the message of why I've changed my mind." We will continue to work very hard, and we will not give up on anybody that might need a vaccine still. Many of the people left to be vaccinated are best supported within and by their community, by people they trust. We will continue to work with resident leaders, faith leaders, primary care partners, community partners to try and increase vaccine rates in these communities. We must continue to work hard to support those that face the most health inequities and the most barriers to wellness. And we won't give up until we reach our goal. Thank you.
Thank you, Kelly. Je passe maintenant la parole au porte-parole du partenariat local pour l'immigration d'Ottawa. We will now hear more from our OLIP representatives, Andrea Gardner and Hindia Mahmood.
Thank you. Hello and good afternoon all. And first, I would like to thank Dr. Etches, her colleagues, Kareem, Kelly, and the other speakers for their hard work throughout this difficult time and for everybody's thoughtful remarks today. My name is Andrea Gardner, and I am the Associate Executive Director at Jewish Family Services. I am also the co-chair of the OLIP Health and Wellbeing Sector Table, together with Nini Cloutier, Executive Director of Somerset West Community Health Center, who's on a much needed vacation this week. I'm here today with my colleague Hindia Mahmood, Director of OLIP, Ottawa Local Immigration Partnership, who will follow up on my remarks. The Health and Wellbeing Sector Table has acted as a platform for our partners to share knowledge, analyze challenges, and collaborate on actions that help to mitigate the COVID risks we knew early on would be facing immigrants and racialized populations in Ottawa. We have worked closely with Ottawa Public Health and the Ottawa Health team to plan and implement targeted COVID-19 preventative and protective measures, including community engagement, outreach and public education, testing, isolation, and vaccination. We applaud all OLIP partners for their tireless and substantial effort to prioritize the communities most impacted by the COVID-19 pandemic. Just a few months ago, we joined our partners at a similar media event to express our deep concern over the disproportionate impact of COVID on Black and racialized communities in Ottawa. At that time, we were reacting to an OPH report which indicated that even though racialized groups made up only 29% of Ottawa's population, they accounted for 63% of the COVID-19 cases in the city. The data also showed that 78% of these were immigrants. At OLIP, we dug deeper, we consulted with community, and we reported on the structural challenges behind this disproportionate impact. It was evident that the disproportionate impact of COVID-19 on immigrants and racialized populations, as has been mentioned by my colleagues, is rooted in social and economic inequities that create structural barriers for racialized populations to access good jobs, for which they are more than qualified, to afford suitable and affordable housing, and to access healthcare, which should be by principle, universal and accessible to all. After so much work, we are gathered again here today, deeply concerned about the disparities in the rate of vaccinations of residents living in low-income neighborhoods, many of whom are immigrants and racialized. These disparities are especially worrisome as we go into the fall, and as many are anticipating, a fourth wave of COVID surge driven by the more transmissible Delta variant. We therefore call for a substantial increase of investment in targeted vaccination strategies focused on bringing up the vaccination rates of residents in low-income neighborhoods. We acknowledge the massive efforts undertaken by the City of Ottawa, Ottawa Public Health, and the Ottawa Health team to vaccinate Ottawa's population, and we acknowledge the many targeted COVID protection measures pursued to improve the reach and uptake of COVID vaccines in the hardest hit areas of our city. Bringing pop-up clinics to where people live, leveraging the networks and institutions of affected communities, working with community leaders and organizations people trust, and hosting dedicated vaccine clinics in trusted community spaces were just some of the many vaccine mobilization initiatives implemented. I personally am particularly proud of the strong collaboration of our health and settlement sector partners in co-establishing dedicated clinics for settlement clients. Settlement workers facilitated clients' vaccine bookings, and cultural sensitivity was brought to all aspects of the work we did. Thousands were vaccinated through these dedicated clinics. These and other efforts made a much needed difference, but it is clear from the data released today that they have not been enough, and we need to do better to close the current vaccine disparities. I'll pass over the mic to Hindia to deliver the rest of our OLIPS message.
Good afternoon, everyone. Thank you, Andrea. We at OLIP find that the neighborhoods with the highest positivity rates are the same neighborhoods that are now shown to have the lowest vaccination rates. In other words, part of the Ottawa public is facing continued high risk of COVID exposure on the one hand and insufficient protection on the other. Although vaccination data has not been disaggregated by race and other social demographic factors, we know we are talking about the same groups. We need to interrupt this pattern of inequity immediately, and we need to equalize vaccination rates across the city to 100%. We have a few specific recommendations that may help us get there. Firstly, we would like to see a rapid assessment of the many targeted vaccination strategies done so far to determine which approaches have been most successful. We need to multiply then the measures that have proven to be effective. Part of the assessment should include hearing from the residents of the most affected neighborhoods, including essential workers, the youth, and the families, and also from civic leaders in these communities. These consultations will help us identify new effective approaches to get to 100% of vaccination in these neighborhoods. Secondly, we need to sharpen our equity lens as we implement a new combination of targeted vaccination strategies. And for these, we will need experts in equity in leadership roles to guide us in these new efforts. This expertise is necessary because it will bring insights on the circumstances and the challenges of the population we are targeting. We are racing against time. Lives are at stake. The fourth wave is coming, and it will affect the unvaccinated most severely. Our only option is to succeed. Thirdly, we need to address the root causes of these persistent inequities and invest in solutions that tackle the social determinants of health, including access to primary health care, including access to economic opportunities that take people out of the burden of poverty in these neighborhoods. Nous devons interrompre immédiatement ce modèle d'inégalité et égaliser les taux de vaccination dans toute la ville à 100%. Nous avons quelques recommandations spécifiques qui peuvent nous aider à y parvenir. Nous souhaiterions une évaluation rapide des nombreuses stratégies de vaccination ciblées mises en œuvre jusqu'au présent, afin de déterminer quelles sont les approches qui ont le mieux réussi, et nous devons multiplier les mesures qui se sont avérées efficaces. Nous devons aiguiser notre regard sur l'équité alors que nous mettons en œuvre une nouvelle combinaison de stratégies de vaccination ciblées. Et pour cela, nous aurions besoin d'experts en équité dans des rôles de direction pour guider nos efforts. Et troisièmement, nous devons nous attaquer aux causes profondes de ces inégalités persistantes. In conclusion, we have come a long way in the vaccination of the Ottawa population. In a few short months, we have reached the remarkable milestone of 75% of the adult population being fully vaccinated. We need to set the goal of eliminating the vaccine disparities facing low-income neighborhood residents before the winter sets in. And then we need to pull our best efforts to reach that goal, Ottawa style. Thank you. Merci beaucoup.
Thank you very much, Andrea. Merci, Hindia. I will now invite each agency in reverse alphabetical order to ask your question. Please remember, you have one question and one follow-up. Nous allons maintenant répondre aux questions des médias en ordre alphabétique inverse. Chacun pourra poser une question ainsi qu'une question de suivi. We'll now start with, nous passons maintenant à Patrick Uguccioni with Your Community Voice. C'est à vous.
Thank you. My first question, more than one speaker has mentioned that this is sort of a race against time. A lot of neighborhoods on this list. What is the reality that you can get to all of these communities in time to I guess, get the uptake you're looking for?
I can start, but I welcome anybody to join in. And we could try all of us being up on video again. It's just, it's nice to be able to pass things back and forth that way, but let us know if the reception doesn't work. So I think the point about time sensitivity is that COVID is still in our community today. While we have really very low rates of COVID, thanks to vaccination, thanks to people taking care and wearing masks, it's still here. And so there's the opportunity to prevent cases. Each person who's vaccinated has better protection. So we want that now. And then as we see measures may change, we may move out of stage 3, we are going to go back into more indoor environments in the fall. That again will put upward pressure on the rate of COVID in our community, and we want people to be protected before that. So that's the time pressure. It is important, and especially for youth, we're trying to make sure that we reach as many youth as we can before school starts, and that, you know, again, that time is now.
And sort of a good segue into my next question. Does your data show you that the uptake changes in an age category? Like, is the uptake higher in the younger age groups than the older age groups? Does your data show that?
It does. We examine the rates of vaccination across age groups. What we see, unfortunately, is that disparity, the lower rates in less advantaged communities, it exists across every age group. Although what I can say the last time I looked at the information was that often it is the youngest age group that has the greatest disparity. So the difference between youth vaccinated 12 to 17-year-olds in neighborhoods with less advantage is greatest. So that is why we need to work with all of our partners to make sure we're focusing on hearing the voices of youth, hearing from them what will make a difference, working with parents, you know, at this time. And so again, if anyone wants to speak to some of the youth-oriented work that we're doing, I welcome that.
Thank you.
Sure. Yeah, I can add a bit, Dr. Etches. So as Dr. Etches mentioned, yes, the disparities across all age categories in our high priority neighborhoods. But as we've seen the youth category across the city be a concern, we've recently invested some time and effort and focus in youth strategies. Again, using a community-centered, community-informed lens, and using both a neighborhood and a population approach, where we're kind of piggybacking existing programming, working with youth-serving agencies to go where youth are at, to you know, speak their language. We've done some things on Instagram Live, and just to try to kind of be present and speak the language of youth. What we're seeing a lot is that youth feel immune to COVID, and also, you know, probably weren't really reflected in a lot of, you know, the overall public health promotion at the onset of the pandemic. So we're also looking at comms strategies as well to make sure youth see themselves reflected in communications, and also make use of, you know, popular people in the community who maybe resonate with youth.
Thank you very much.
Thank you. We'll now move it over to Kenyon Wallace with the Toronto Star.
Great, thank you so much. Looking at the most recent provincial vaccination data, Ottawa has done pretty well in comparison to a lot of other public health units. I believe you are now fourth, with 75% of people over 12 now fully vaccinated, and even higher percentages if we're just looking at people with one dose. I'm wondering if you could just give me a few examples in terms of things that that Ottawa Public Health has done that has helped encourage people to come out and get vaccinated, or has helped break down some systemic barriers that has allowed you guys to see such a, comparatively speaking, such a good record on vaccinations.
I think what you're seeing today is that we ran a very efficient operation, getting large clinics up and going and using all the vaccine as it came in as quickly as we could. And while that was effective in getting a large proportion of the population immunized quickly, it wasn't enough to make sure that was even. And so part of what we did start with, and we continued throughout, was a neighborhood-based approach. And what we're doing now is we're taking the resources that were invested in those large clinics and we're growing the neighborhood approach. So I think the concentration early on with people over 80, it's where we started our neighborhood approach, was for people over 80. So the conversation did start early in neighborhoods. I think what we're focused on today is we see that one size doesn't fit all, and we need to move now into more varied approaches to address different barriers. So I'll just, Andrea, I think I see what would like to add.
Yeah, I think one of the things that we did is we partnered. We had some unusual partnerships, and so I can't speak highly enough about a coalition of settlement agencies coming together with Ottawa Public Health and family health teams, and just strategizing on what was the best way that we could engage communities that would not otherwise walk into some of the mass clinics or feel comfortable going somewhere where there wasn't language or cultural sensitivities. So hosting clinics, having staff there who knew the client base that was coming in, doing the door-to-door that the Ottawa Health team was doing. It was really looking at where we could be flexible and nimble, and stripping out some of the administrative and just diving right in and doing it and seeing what worked and then correcting as we went along made a huge difference in being able to reach communities who would then go back to their community members and say, hey, this was okay, or I knew somebody who was there, or they walked me through it, or they held my hand. There was private rooms around cultural modesty, so if that was an issue. And it was really just being where our client base was and working with them made a big difference in getting to the smaller groups. It's not done enough of it. We still have much more to do, but it was definitely a start.
Great, thank you very much.
I can add perhaps a bit to the approach. In addition to some of the strategies, I think a lot of it resides in the approach, at least in the engagement and the neighborhood level. I think the success that we've had has come from taking an approach that is community-centered and community-focused. Nothing for us without us was kind of the model that we employed. So working hand in hand with community partners, involving residents in response strategies, centering their voice and their concerns, and really taking an approach that is centered in equity, as Hindia mentioned. What was important is, given it's an emergency, it's and the race to getting everyone vaccinated, it's easy to rush to a solution without considering people's needs. And so we really centered that in our approach, starting with what people are concerned about. Oftentimes our conversations don't start with vaccines. We listen to community residents, and again, by working hand in hand with partners, we're able to address some of these systemic issues that actually stand in the way of building that confidence for vaccine, and really working with out of a place of respect and patience, because these things don't necessarily turn around on the same day. It requires time, and we've seen that. And part of the story is, while these neighborhoods are still behind, there's been growth, there's been improvement. And that reflects the importance of time and patience.
Great, thank you very much.
Did you have a follow-up question at all, Kenyon?
No, that's perfect.
Okay, thank you. We'll now move
Thanks.
over to Rosalie Sinclair avec Radio-Canada Ottawa-Gatineau. C'est à vous, Rosalie.
Oui, bonjour. Ma question est pour Madame Etches. J'aimerais savoir, est-ce que la santé publique d'Ottawa songe aussi à demander un passeport vaccinal, soit au gouvernement fédéral ou encore au gouvernement ontarien, ou encore est-ce qu'on songe à mettre en place un passeport vaccinal pour Ottawa?
C'est clair que la protection contre COVID-19 avec un vaccin est clé. Et on va concentrer sur toutes les actions qui peuvent augmenter le taux de vaccination dans notre communauté. Mais on commence avec la fondation que toutes les personnes qui veulent être vaccinées ont les opportunités. C'est les choses qu'on discute aujourd'hui. Il y a des gens qui restent avec des barrières. Alors, on a besoin d'éliminer les barrières premièrement. Et on a différentes méthodes d'augmenter le taux de vaccination. Et maintenant, le niveau de COVID-19 dans notre communauté est bas. Alors, d'avoir une politique obligatoire, ce n'est pas nécessaire à ce moment. C'est aussi une question de la politique de la province. Nous sommes tous connectés en Ontario. C'est meilleur d'avoir une approche provinciale et c'est quelque chose qu'on discute avec la province. Si la situation est plus mauvaise, est-ce qu'on peut être préparé avec d'autres options, différentes options? Alors, pour nous à Ottawa, notre travail, c'est d'augmenter le taux de vaccination avec les différentes stratégies qu'on discute aujourd'hui.
Parfait. Pour ma question de suivi, je voulais savoir, comme le passeport vaccinal va être en place au Québec, donc entre autres à Gatineau à compter du 1er septembre, est-ce qu'on craint que des gens non vaccinés du Québec viennent en masse là, à Ottawa, considérant notre réalité transfrontalière dans la région?
Pendant toute la pandémie, nous avons l'approche que c'est presque une population à Ottawa et Outaouais. Nous habitons ensemble, on travaille ensemble. C'est vraiment une population connectée. Alors, le niveau de COVID dans les deux côtés de la rivière, c'était similaire pendant toute la pandémie. Et la vie de santé publique d'Outaouais et santé publique Ottawa aussi reste la même à la base. Par exemple, d'éviter les actions qui donnent plus de risques, de porter les masques à l'intérieur et dans les foules et d'être vacciné. Alors, on continue avec ce processus de faire la surveillance, examiner le taux dans les deux côtés et de recommander les mesures importantes, mais ce n'était pas possible de diviser la population.
Merci beaucoup.
Merci beaucoup, Rosalie. Merci, Dr. Etches. We will now move it over to Bruce Eachman with Ottawa Citizen. Bruce?
Hello there. Can you hear me?
Yes, we can.
Okay. I guess my questions will be for Dr. Etches, although anyone else can jump in. My first question is, I think throughout this, we've had this sense that if we hit 75% fully vaccinated, that we would have some sort of herd immunity. And I think today's data is sort of clear that that's not really the case, that we have to look more at sort of the links in the chain, if you will. I mean, I haven't added it up, but I think maybe 2/3 of the neighborhoods are, although the city's at 75%, 2/3 of the neighborhoods are not. And I'm wondering if you have sort of hard numbers that you, I mean, because I think we can both agree we're not going to hit 100%. What are the numbers that you have to hit?
Thank you for the question. I actually am deliberately speaking about community immunity, not herd immunity, and I'll make the distinction. Herd immunity is the idea that we would have enough protection from vaccine that we would stop transmission of the virus in the community. And I think we've known for a while that that would be challenging to reach. And so when I speak about community immunity, I am aiming higher than 75. I think we've been talking about 90% for quite a while as our goal. And I do think we can get there because the higher we go, what we get is individuals who are protected and fewer unvaccinated people who are going to be at risk of more severe illness, like hospitalizations or even death. And so we're really trying to push the community immunity level up because it will slow down the transmission. It already is slowing down the transmission of COVID in our communities and protecting the individuals who are vaccinated. And what we're trying to do is, have it high enough to stop the spread among unvaccinated as much as possible. So it is true that more even coverage is desirable rather than having neighborhoods with a lot lower rates where there are more people unvaccinated, both for those individuals who will potentially have more severe illness and for the population because there could be more transmission. But that's the point of monitoring this. This is why we have this information, this data, is so that we can close that gap, so that we can make sure the protection is extended to everyone.
Okay, and my follow-up is this data, the data that's come out today is only a point in time, right? It's as of August 2nd, here's what it is. And of course, it'll be 4 weeks before we even have a hint of a trend. What I'm wondering is, do you have information, do you have data that suggests what you're doing in the high priority neighborhoods is working? Like, are those numbers increasing dramatically or are they not? I mean, I know a lot of people have said they're getting better, but I mean, if one more person gets vaccinated, that's better, but it's not better enough.
So yes, I did hint at this in my comments in that we are seeing week by week, we look at this week by week, that the percentage coverage in the neighborhoods with less advantage is going up. So it's consistently going up. And we expect that to continue because we're only still at the beginning of establishing hubs and really, pouring the resources from mass clinics into neighborhoods. So I have a lot of hope for the rates and the protections to grow in these neighborhoods within the next 4 weeks for sure, and week by week. And I think as Kelly Tonner said, we're not giving up. We're going to be here for the long run. We'll keep at it. And so I think the other thing I didn't mention in my first part of the answer about, is there a number, is there a percentage, why was 75% used so much and now we're talking higher? That difference is the Delta variant, right? So with a more transmissible virus variant, we have to have greater protection. That's where that's coming from.
Thanks very much.
Thank you, Bruce. Je vais passer la parole maintenant à Julien Paquette avec le droit. Julien, c'est à vous.
Bonjour. Ma première question, ce serait pour la Dr. Etches. Vous avez mentionné à plusieurs reprises aujourd'hui que les chiffres à Ottawa demeurent relativement bas, mais on s'attend un peu tous à ce qu'une quatrième vague arrive. Donc, puis on voit les chiffres augmenter autant dans le reste de l'Ontario que le Québec. Donc, est-ce qu'on s'approche de cette quatrième vague-là? Est-ce qu'on y est même déjà un peu arrivé ou on est encore un peu loin?
Je voudrais dire merci à toute la population à Ottawa qui continue de contribuer le bon taux de COVID et vaccination à Ottawa, parce que quand je vois le mesure de COVID dans notre lot usé, c'est presque stable, ça diminue, ça augmente, ça diminue, mais c'est presque stable. Alors, ça prend caution, ça prend attention au nombre de contacts proches sans les masques et je pense c'est inévitable d'avoir une augmentation quand le nombre des interactions, les relations proches augmentent. Ça va arriver. La question, c'est est-ce que le niveau de COVID qui augmente, est-ce que c'est sérieux concernant le taux des hospitalisations? Et on peut regarder la situation en avril cette année. Je pense que le maximum nombre de personnes dans les hôpitaux, c'était 124. Maintenant, c'est 2, 3, 0, 1, 2, 3. Et on peut gérer la situation si le nombre de personnes dans les hôpitaux augmente lentement. Mais si le nombre de personnes dans les hôpitaux augmente trop vite, avec la grande augmentation, on a vu auparavant, ça c'est quand je vais avoir des inquiétudes.
Et puis, deuxième question, je veux juste clarifier. Donc, il y a eu une annonce ce matin par rapport à la création de cliniques de quartier. Donc, juste clarifier un peu, si j'ai bien compris, dans le fond, on prend les ressources des cliniques de vaccination de masse, les grandes cliniques qu'il y avait, par exemple, au Sportsplex de Népine, puis à l'Hôtel de Ville, et on les dirige dans les quartiers. Donc, combien de ces petites cliniques-là on s'attend à créer au cours des prochaines semaines?
Oui, j'imagine au moins une dizaine. On essaie de créer une présence dans chaque quartier prioritaire. Et je dirais même que dans certains quartiers, on a placé et on envisage placer même plus qu'une clinique, vraiment pour maximiser l'accès. Déjà dans l'ouest de la ville, on est à trois sites. Et essayer de créer vraiment une variété d'horaires aussi, soirée, fin de semaine, la semaine, pour donner toutes les options possibles aux gens. Effectivement, on suit les statistiques en plaçant ces cliniques justement où les quartiers sont les plus affectés et les plus impactés. Et encore une fois, comme toutes nos autres activités d'engagement, ces cliniques sont placées et choisies avec la rétroaction, soi-disant, de la communauté. Donc, on travaille main à main avec les organisations, les résidents, les centres de communauté sanitaire pour choisir des lieux qui sont adéquats, très accessibles.
Si vous me permettez, juste une petite question de précision. Quelle est la principale différence entre ces cliniques-là, ces nouvelles cliniques-là, et les cliniques pop-up, entre guillemets, qu'on a eues au cours des derniers mois?
Oui, les cliniques pop-up étaient un peu plus grandes. Elles étaient assez proches des quartiers, mais comme il y en avait beaucoup, elles circulaient un peu à travers la ville. Donc, par exemple, on avait un pop-up dans le sud de la ville un dimanche, un lundi. Ensuite, le mardi, elle était à Vanier. Il y avait un peu de circulation et c'était très bénéfique pour la communauté, comme les chiffres ont démontré. Avec la nouvelle approche, on va pouvoir maximiser et offrir ce service chaque jour. Donc, on estime pouvoir avoir des cliniques 7 jours sur 7 dans toutes les communautés de manière simultanée. Et de plus, de les avoir encore même plus proches. Donc, certaines de ces cliniques sont même dans des foyers de certains immeubles. Elles sont vraiment situées au sein des communautés et des quartiers.
Merci beaucoup, Julien. Merci, Karim. I will now move over to Craig Lord with Global News. Craig?
Thanks very much. Dr. Etches, how would you, I guess, evaluate the success of the early rollout that was targeting the high-risk neighborhoods if we're still seeing that many of those neighborhoods are experiencing the lower rates of vaccination? Was there more that could have been done in those early stages to give more protection where we're seeing low rates now?
It is a success when anyone is vaccinated, and we certainly wanted to use the vaccine as it came in to vaccinate as many people as quickly as we could. So it was about striking a balance. We were the first health unit to use a postal code-based approach for the population most at risk of death and hospitalization, people over 80. We did continue that, but I might actually ask other partners to comment on success. Maybe I'm not the best person to speak to this. We have had direct feedback from clients of the neighborhood kinds of interventions that people indicated it does make a difference. And we definitely have limited resources to be everywhere all at once. And so, this is why we're taking now the opportunity of resources that have invested in the large clinics to have more capacity in smaller clinics. But the numbers show we do have more work to do. Exactly how we struck that balance as we went along was a ongoing discussion. We were constantly looking at the rates in neighborhoods and thinking about what more could be done. As Kareem said, getting input from communities about what was effective, what would make a difference, and adapting. So anyone, please jump in with your thoughts and reflections.
Yeah, I'll just add that, this was a bit of an iterative process, again, of working with the community, putting interventions in place, trying new things, learning from others across the province, and rolling out different options for people. And as Hindia has said, we've been looking at all of those different options, all the different ways in which we've relayed information, ways we've responded to community, options we've provided within these communities to access information and the vaccine. And we've been trying to introduce new things while also transitioning to things that might work better for people now at different stages of the pandemic, at a different place where people are at. So, where people at the beginning maybe were very mistrustful, then it became just a matter of access. And so we put in, the pop-up clinics. We saw massive droves of people going to these pop-up neighborhood clinics. We got better at doing the neighborhood clinics. When we saw perhaps there was now a population of people that required a more intensive or even more micro community, more micro level intervention, we started introducing those interventions as well. So the homebound vaccinations, the community hubs that are being established now. And I think we've all recognized that for all of the tremendous efforts that all of the partners have put in, there's still work to do. And we still need to learn from community, and we still need to work together as a collective to really meet the needs of communities who face the most inequities. It is incumbent upon us to find out what is it that is in your way of accessing a vaccine or of getting the information that you need. And it's incumbent upon us to figure out the quickest, most efficient and effective way of getting people what they need, be that information in their own language, be that a vaccine at your door, be that a trusted healthcare professional that reflects your culture, that reflects your language, explaining to you or having a conversation with you about your needs. So I believe that there's been a tremendous amount of work, and we've had great success. The neighborhoods, the majority of people in these neighborhoods are vaccinated. The majority of people in these neighborhoods are vaccinated, but there is still a disparity that we must address. Hindia, you're on mute.
If I may add, I agree with what Kelly said. The effort was tremendous, and we were charting the course as we were doing the work. So, hindsight is 2020, as they say. The realization at this very moment is that where we are at is not good enough. So that is where our starting point today is. And what we are recommending is a formal evaluation of the variety of strategies put in place, rapid but formal. And we are recommending that the new combination of strategies going forward should be informed by the residents of these neighborhoods. The reality is that inequities are the default and embedded in our structures, in our process, in how we receive data and how we receive information. So having the circumstances of the neighborhoods, residents of the neighborhoods that are not fully equally vaccinated is going to be part of the information we need as we evaluate, and part of the information we need as we craft new combination of strategies. And I know that there's the appetite, everyone who's been working so hard. The core objective is to get to as high a percentage of vaccination as possible. My target is 100%, whereas it's 95%. She's more realistic than I am, perhaps. But I think we can do it. We've come a long way, and we've done a lot of tremendous work, but we are unsatisfied with where we are at now. And the risk is high, and lives are at stake. So we are resolved as a team, as collaborating partners, to do better. And I think we're going to need the formal evaluation to look at those.
Thank you very much, everyone, for your input. My quick follow-up, if I can, to Dr. Etches, I was wondering if I could get your take about University of Ottawa's decision to mandate vaccinations for those on campus, and specifically whether you think that will move the needle on the 18 to 39 crowd and getting more vaccinations there.
I do see a pattern where across all the neighborhoods, people 18 to 39, are less protected with vaccines, and so vaccination policies where workplaces, places of education assist in making vaccine available, promoting vaccine, addressing people's questions, demonstrating why it's important. All of this is going to help with the overall level of COVID in our community, because it is also a population that has the highest rates of COVID right now. So I am thankful that our post-secondary institutions are examining how they can assist. And, I do strongly recommend that the vaccination policies really, again, are another way to decrease the barriers that some people may have. They may not have an Ontario health card, and they don't realize you don't need an Ontario health card to get a COVID vaccine. They may be international students. You can still get a COVID vaccine, right? You might have had a different vaccine somewhere and it doesn't count. Well, you can still get a COVID vaccine here, right? So this will help with that dialogue with each and every person who is involved with campus life in person.
Great, thank you all very much.
Merci, Dr. Etches. Thanks, Craig. We will now move over to Josh Pringle with CTV Ottawa. Josh?
Thank you very much. My question is for Dr. Etches. Ontario unveiled today separate self-isolation rules for vaccinated individuals. I was wondering your reaction to these new self-isolation rules, particularly around the suggestion that those who are unvaccinated but have had COVID in the past 90 days will not need to isolate if they test positive again.
So I think I'll need to review the document in detail, but I think what you're seeing is that there's a recognition that when someone's vaccinated or they've had COVID recently, that there's a level of immunity there that provides protection against COVID infection. That means that when someone is exposed to somebody who tests positive for COVID, we're confident that they're much less likely to actually develop the infection. And so we can treat them differently when it comes to isolation. So that, again, for people who might not have heard this before, they're watching, it's an advantage when you think about it of being vaccinated. Then even if somebody in your workplace or your school does have COVID and there was an exposure, you still will be able to continue with your work in your school and go about your days without having to isolate, because we know the vaccine makes a difference. So that Ottawa Public Health follows the provincial case and contact management guidance, and we will be using this approach.
Thank you. My other question, just with the new community hubs that you're setting up, has Ottawa Public Health looked at, and maybe this comes down to staffing, looking at setting up in parks, going street by street, to into these neighborhoods where people have barriers to go to a clinic or something like that, where you're in a place where people are already congregating, like in a park, a beach, places like that, to help boost vaccination moving forward?
Yes, we're using a combination of approaches. So the mobile option that I referenced earlier would offer that option. We're open to setting up tents. As a matter of fact, even the community or neighborhood hubs that we talked about in high priority neighborhoods will have the flexibility of moving around in neighborhoods. So if we identify that folks can't leave their home, immunizers will walk over to the home and provide a vaccine. And again, sometimes these hubs are leading to mobile clinics or vice versa. So we're open to any kind of community activity as highlighted or requested by community. We're actually looking to piggybacking existing programming, things like the food bank, really going where people are at, and that does include outdoor spaces and tents and places where people are likely to congregate.
Thank you.
Merci, Karim. We will now move over to Eric O'Brien with City News. Eric?
Yes, hello. My question is for Dr. Etches. Most of my questions were answered, but I will ask you this. I understand that the strategy moving forward is really to take on a targeted approach to for vaccination specifically, but in the meantime, I mean, kids are going to be heading back to school soon. Businesses are open, and data right now is showing that we may be heading towards a fourth wave in the pandemic. So given the fact that we now have more specific data on communities regarding vaccination rates, is there a plan moving forward for protecting less vaccinated communities in a fourth wave?
This is a really important point to emphasize, that this neighborhood level data of vaccine coverage does not help us understand the risk of COVID in these neighborhoods. And first of all, there is, it's based on address of where people live. It doesn't relate to where people spend most of their time working or in school. The unvaccinated population in Ottawa is across the whole city. So you can't draw a circle around the unvaccinated population in Ottawa. And we know previously from our work on case and contact management that we are a very connected city. People move across from Orleans to Canada to Manatik, and we did talk about Outaouais. So there's no sense that we could be effective with public health measures that target a neighborhood with more restrictions on gathering or anything like that. It is not on the table. It would not likely succeed, and it would have harmful effects. And so this data is to help with the outreach to where people live, where we can work on getting the vaccination rates higher. It doesn't relate to risk or measures that we need to implement for COVID control.
Thank you very much for that. Maybe I'll just ask you if you can repeat, is there any worry of non-vaccinated people now that there's a vaccine passport in the Outaouais region of coming across to Ottawa, in the coming months, I guess?
What I said in French was roughly was that we really are one population. On both sides of the river, we're connected by work, we're connected by social relationships. And so what we've seen in the data is that our COVID rates are very similar throughout the pandemic. It's been similar pattern on both sides of the river, even though we've had different provincial guidance. And so what I was pointing to in French also was at the base, at the foundation, our public health guidance in Outaouais and in Ottawa is actually the same, to choose lower risk activities and to wear masks inside when you're gathering with people who you don't know might be vaccinated or not, to avoid crowds without mask protection, so so these measures we can all use, and people are. I mean, you see the levels in Ottawa are low right now. So I just want to encourage everyone to continue doing what they're doing, because it is keeping COVID levels manageable. And we'll evaluate each step of the way as we go if things are changing. And I believe what I also said in French was that it is the hospitalizations that I'm monitoring, in terms of when will I start to be more concerned. And for context, I mentioned in April, we had 124 hospitalizations, 21 in a given day was the highest. And that was at a time when the hospitals had to stop their elective surgery. They had to redeploy their staff. I think CHEO was taking adults, right? That was tough times. And right now we're at 1, 2, 3 people in hospital. So we can manage this situation. What we can't manage is a rapid rise. And so I'm just as concerned about the rate of increase in hospitalizations as I am any given number. And so again, Outaouais and Ottawa will be comparing notes. We'll be looking at those hospitalizations and staying connected and informing people on both sides of the river.
Thank you.
Oh, I might need to step in here for Julie for our very last reporter, Kimberly Molina, CBC Ottawa. Thank you. Kimberly, are you still with us? I can see you. Okay, Kimberly, I can see that your microphone icon seems to be working, but we can't hear you. So feel free to email us your questions at ophmedia.com or at ottawa.ca, sorry.
Can you hear me now?
Yes, we can hear you
Oh, okay,
now.
Great.
Go ahead.
Apparently I just didn't have the right thing clicked. So this is for Dr. Etches or whoever wants to address it. But from a quick glance at the map, Ledbury Herongate seems to have some of the lowest vaccination rates in the city at 62.5%. But it was also one of those neighborhoods that was targeted very early on by OPH and community teams. So I'm just wondering what has been seen or been heard as some of the specific barriers that are standing in people's way there for increasing the vaccination rate in that particular community. And some of the other communities. I know you've sort of addressed sort of higher level issues that are facing people. I'm just wondering about that specific community.
Right, I think you've heard my higher level comments, and I invite partners on the ground who've been working in that community to comment further. Thanks.
Thanks. I can make a comment. These are neighborhoods that have historically faced inequities, oppression. They've historically had challenges with systemic barriers. And so we're seeing that play out in the context of COVID and vaccine uptake. We continue to hear from people on the front line that they're not really sure about all the information. It's coming from everywhere. It's coming from the news, and that can be a bit confusing sometimes. It's coming from their peers, from their family members, from community members. And we know that there's a lot of not just misinformation, but disinformation out there, intentionally putting out, kind of bad data and bad information. And so it's really a significant amount of work to build the trust and build the relationships and to work with the community to ensure that they're hearing from people that they know and trust, that they're hearing from the leaders in their communities. They're seeing those leaders lead with information about COVID, about vaccine uptake. My colleague Kareem has mentioned a number of initiatives that have come to fruition. And we continue to hear from people in this community just how much they're dealing with. They're not just dealing with COVID. They're dealing with the impacts of poverty. They're dealing with the impacts of trauma. They're dealing with the impact of, not being able to make ends meet. Worried about their children, worried about their future. There's a lot more on the plates of people who are historically facing inequities that they have to sort through. And they often do it with less support, less networks. I myself have lots of people I can call. I have lots of contacts in the healthcare sector, obviously I work in a health center, who I can ask my questions to. I have lots of people I can call to deliver food to my house, or if I had to isolate. That is not the case for people who are living in more difficult circumstances. And so I believe that the reason why, this is an ongoing kind of challenge and requires an exceptional effort to address is because this is a situation that isn't just about COVID. It's a situation about systemic inequities and the social determinants of health.
So specifically for something like that neighborhood, I mean, have there been discussions with companies that employ people there about giving them time off, about especially if they are sick? You mentioned, companies can go to the website to kind of find out more information or to schedule a mobile clinic. But have there been sort of those direct conversations with those businesses about being able to give people time off, about if giving them a sick day or something, so that they have that extra step to be able to get a vaccine? I'm just wondering sort of what you're hearing from companies who might employ some of the people who live in those neighborhoods about the assistance for them.
I was just going to say, I don't want to speak on behalf of my Ottawa public health colleagues, but they've done an exceptional amount of work reaching out to employers. Kareem, I'll let you describe some of the efforts that you guys have made.
Thank you, Kelly. Yeah, no, we've done a bit of work kind of across the city on the topic of employers and workplace clinics. There was a particular employer that employs quite a number of residents from the Ledbury-Harringate area, particularly residents who actually had significant language barriers. So it was a bit of a collaboration between the employer, community partners, and our public health to kind of facilitate the information, the clinic itself. So that approach has been explored. And again, of course, need to do a lot more of that. And as well, just sometimes even working strategically, we found that on the ground through our door-to-door check-ins and outreach, we've heard from residents, not necessarily have a barrier to get to the clinic, but a concern that the symptoms would prevent them from working. So, just being strategic with little things like that, having them maybe suggest to book a vaccine for them on a Friday so that they can kind of rest through the weekend. So it's kind of a plethora of strategies and efforts around employment and location. But yeah, definitely, as you've mentioned, suggested, and Kelly's actually, spoken to, lots of concerted effort in the area. But because these are long pre-existing systemic issues, it does take some time and some creativity to address.
Can I just quickly ask what the company, were they receptive to that about giving time off or bringing in assistance?
Yes, they were receptive. Well, we hosted a clinic at the workplaces is what we did.
Thank you.
Thank you so much. That's all the time we have for today. C'est tout le temps que nous avons aujourd'hui. I want to take just a quick minute to thank all of our speakers, all of our media. It takes a community to tackle COVID-19 in Ottawa, and we're so thankful and so grateful for all of our partners and all of the individuals living in Ottawa. Merci à tous, à nos partenaires communautaires. Ça prend vraiment un aspect communautaire pour combattre la COVID-19 dans notre communauté. Nous vous apprécions et nous vous remercions aujourd'hui. Thank you so much. Have yourself a wonderful day. Merci. This concludes our media availability.